New York has seen some tough winters, but what is happening right now is unprecedented. It is late December 2025, and the New York State Department of Health has just confirmed a number that has sent shockwaves through the medical community: 71,123. That is the number of positive flu cases reported in just one 7-day period ending December 20th. It is the highest weekly total ever recorded since influenza became a reportable condition in 2004. We are currently witnessing a 38% explosion in cases in a single week. Today, we're going behind the headlines to look at the subclade K variant, the 63% spike in hospitalizations, and why New York is now the epicenter of a national tripledemic. Why is New York being hit so hard? The evidence points to a new, aggressive version of the virus, influenza H3N2. Subclade K. This isn't your average seasonal flu. Genetic characterization from the CDC shows that nearly 90% of all H3N2 viruses now belong to this specific clade. So, what makes it different? Subclade K has undergone a process called antigenic drift. It has mutated just enough that it's getting around our existing immune defenses. While this year's trivalent vaccine still provides protection against severe illness, it is currently a genetic mismatch for preventing infection from this specific variant. This is why even some vaccinated New Yorkers are finding themselves bedridden this week. The sheer volume of cases is one thing, but the severity is another. Statewide, flu-related hospitalizations surged by 63% in the last week, jumping from 2,251 to 3,666. Commissioner Dr. James McDonald has officially declared flu prevalent across the state. This isn't just a label, it's a legal trigger. Under New York public health law, this declaration mandates that all healthcare personnel who have not received this year's flu vaccine must wear masks in areas where patients are present. We are seeing hospitals in Long Island and the Hudson Valley activate emergency surge protocols to deal with the influx of respiratory patients. New York isn't just fighting the flu. We are in the middle of a tripledemic. Cases of RSV and COVID-19 are rising simultaneously, creating a perfect storm for our ears. But there's a deeper issue. Only 24% of New Yorkers have actually received their flu shot this season. There is a massive communication void where skepticism has replaced science. Public health experts like those at Johns Hopkins are warning that this trend will likely carry into the new year, potentially peaking in January. We look at the data. Even with the subclade K mutation, the vaccine reduces your risk of death or intensive care by over 40%. The evidence is there, but the uptake isn't. As we head toward the Times Square ball drop, the message from Albany is clear. New York is in a state of viral emergency. The 71,123 cases we saw this week may just be the beginning of the curve. Wash your hands, wear a mask in crowded spaces, and if you haven't get the shot, the evidence shows it's the only way to prevent our record-breaking week from becoming a record-breaking winter. I'm your host for The Evidence Edge. Stay safe, New York.